It's informative. It's healthy. And it's the news. Welcome to the Health Connection. Welcome to this month's special episode, COVID-19 vaccines.
Hello, everyone. Good afternoon. Thank you for joining us on the Health Connection. My name is Kishi Martin, and I am the Health Promotion Peer Navigator here at Care Resource. Today on the Health Connection, we will be discussing the COVID-19 vaccines, and joining me to tell us what exactly is going on is Dr. Kathreen Kraus, our infectious disease specialist. Hi, Dr. Kraus. Good afternoon.
Hi. How are
Hey
you?
there. Hope all is well. Please introduce yourself. Tell the people who you are and what it is that you do.
Well, I'm Dr. Kathreen Kraus. I've been at Care Resource for the last 6 years. I am internist as well as an infectious disease specialist. And today we're gonna talk and might be able to answer some of your questions about the COVID vaccines.
Awesome. I'm glad you're here with us, and I look forward to whatever it is that you're going to share with us. And now the first topic that we are going to get into is how vaccines work.
Okay, so so far in the US, we have 3 vaccines against COVID-19 that have had an emergency authorization. Okay, there are 2 of them are the mRNA technology, which is called the Pfizer and the Moderna. And then we have a 3rd vaccine, which is the Johnson & Johnson, which is more a traditional virus-based technology.
All right. So let's see. We have 3 vaccines at the moment. All of them are very different from each other, or are there some similarities?
So one of them, as I mentioned, which is the Johnson & Johnson, is just a single dose. This is more like a traditional vaccine that we have, right? It's more virus, it's a viral technology. That one only is 1 dose. And after 2 weeks of getting the vaccine, you should have a 76% efficacy of being protected against moderate to severe COVID, okay? And then the other 2 vaccines are the Moderna and the Pfizer. As I mentioned a little bit earlier, those are the mRNA technology. For those, you need 2 doses, 4 weeks apart for the Moderna and 3 weeks apart for the Pfizer vaccine. To be fully vaccinated with those vaccines, you need to pass 2 weeks from the 2nd dose to have the 95% protection against COVID-19.
Awesome. That's a pretty high percentage. I'm glad.
Yes.
And now we are going to discuss the side effects.
So for all of the 3, the side effects, the most common ones are, especially at the side of the vaccine, right? Some of the patients, they might complain of some redness, some pain at the side, and also some swelling. The most common side effects, in general side effects are, for example, headache, fever. Some people get some muscle aches. Some people get some feel tired. And then you might have more severe side effects, like, for example, when someone has an allergic reaction, like a swelling of the face, or you can have an increased heartbeat, or a rash, or dizziness. Those are with the 3 COVID vaccine, the most common side effects. There is 1 vaccine, which is the Johnson & Johnson, where recently we had reported 15 cases of thrombosis within more than 7 million doses given, right? So, but it's very rare, and this have seen mainly in females within the age of 21 and 48 years of age.
Okay, well, thank you for that information. And lastly, we will also discuss benefits versus risks. I'll name the vaccine and then you can give a benefit and a risk. So let's start with Pfizer.
Okay, so in general, okay, if we talk about the vaccines, they are very safe and effective, right? What are the risks with any vaccine, either with Pfizer or Moderna or Johnson and Johnson? Are the possible side effects, which are usually very mild and very uncommon. The benefits is that you protect your body against developing a percentage deadly disease, right? So I think the getting the vaccine outweighs the risk in most of the people, and so far it's been considered pretty safe and effective vaccines.
No matter the dose, because right now, obviously, there's a lot of hesitance. A lot of people are not sure if they want to take it or not, and people have become attached to one shot over the other. Like some people prefer, oh, they only want one shot because one and done. And then some people say, well, I prefer a higher efficacy. But what you're saying is, regardless of the manufacturer, the benefits and the risks are still about the same, and that we shouldn't play favoritism, basically.
Well, at the end, what we want is to get a vaccine that is available for us to get, right? Because what you want is to avoid to get sick and to end up in a hospital needing oxygen or any other medication that might be if you have severe or moderate COVID. So the three of them have shown to be very effective against developing moderate to severe. The Johnson and Johnson it's 100% effective for moderate to severe, but it's only 76% effective for mild cases, right? So you can still get in 25% or 24% of the population, you can still get COVID even if you get vaccinated.
Yeah, that's true. And I have another question, just because there's only 3 right now, but are you aware of anything that's happening in the works that might be coming along the line? Like, is there another vaccine or a few vaccines that are being worked on right now that you're aware of?
No, that I'm aware right now, no. I know that now they're expanding the age for the vaccine because we know, for example, Pfizer is approved for 16 and up. Moderna and Johnson are approved for 18 and up. And hopefully by the summer, they're going to expand, at least I believe, the Pfizer vaccine for 12 and up. So
oh my gosh,
that's going to be
really
good. Hopefully, yes.
Yeah. Okay, well, you've given us quite a bit of information in such a short amount of time. Is there anything else that you would like the viewers or us who are part of the show to know? Is there anything you'd like to leave with us in regards to the vaccine?
So my comment would be vaccines, they're like the 3 of them, they're pretty safe and they're very effective. If you can get it, I will advise to get the vaccine, okay? Because if you can avoid getting sick from COVID, it's gonna be much better, right? So my advice is get the vaccine.
Of course. Thank you so much for sharing that. Really quickly to everybody watching, for those of you who are care resource patients in the medical department, just to let you know, if you're registered, you can get a COVID test. You can do the swab or you can do the antibody test. Also available to care resource clients, patients, and non-patients as well. There's some registration you have to do, but also the vaccine is available currently to those who
Yes.
get an appointment, correct? That is what you would have to
At
do.
this
is you
time,
need an
we offer the Moderna, which is the 2-shot 4 weeks apart, and we also offer the Johnson & Johnson, which is a single vaccine dose.
Okay, great. Well, thank you so much, Dr. Kraus, for joining us at the Health Connection. I hope you will come back because as time goes on, we will need more information about the COVID vaccines. So I hope to see you again here soon.
Thank you very much for having me.
You're welcome. Again, to everyone watching at home, thank you so much. Remember, we need to stay safer. We still need to wear a mask, social distance, wash our hands, get tested for COVID, and get the vaccine. Until next time, thank you so much. Take care.
Thank you.
Don't forget to like us on Facebook at facebook.com/care resource, or follow us on Twitter at careresourcefl, or subscribe at youtube.com/care resource. For more information or to find a location near you, visit us online at careresource.org.